Hi, welcome to Body Beautiful. I'm Janelle Marie. Today I'm talking with Dr. Joseph Mealy, board-certified plastic surgeon in Walnut Creek, and we are talking about all things plastic surgery because, Doctor, you've been in practice for over 24 years and you're always giving out great information on plastic surgery. So thank you again for joining me.
Thanks for having me.
And we are going to talk right now about thigh lifts, and this is so interesting because first of all, I didn't even know you could do thigh lifts. So this is
Sure.
great information. Tell me about it. Who comes in for a thigh lift?
It's not one of the most popular procedures or the most often requested procedures.
Right.
But with the advent of bariatric surgery and large weight
yes.
loss, it's become more important as
Absolutely.
a procedure for reconstruction after weight loss.
And we know about tummy tuck scars, so let's talk about scars on thigh lifts because I could imagine people wonder, well, how are you going to do a thigh lift without leaving, a big ugly scar?
Well, there's a couple of places that we put the scar. Now, when we're worrying about that upper part, sometimes it's like drapery.
Yeah.
Then we can put the scar up in the groin, and it wraps around between the legs and goes along the fold under the buttock. So it's a pretty well hidden place. It may not be hidden by a tiny bikini bottom, but certainly short will cover it well. The other scar runs along the inside of the thigh from the knee all the way up to the groin. And that one's really important when we have a lot of extra skin at the knee because it'll remove skin low.
Yeah.
But the scar is a little more visible because it's running along the middle of the leg.
I mean, it's great to know. It's literally like pulling up your pantyhose. So let's go to picture number one and talk about how you do it and what's going on here.
Sure. So this is someone who came in, lost weight, has that typical drapery along the inner part of the thigh, and down around the knee, not quite as loose. And there's a zone in between that upper and lower part that's kind of attached. If that skin is attached well and the knee's still supported, we can get away with just putting the scar up top and hiding it.
Oh, that's good.
So in this case, I've made an incision, kind of like a tummy tuck on the inside of each leg that gets rid of all that extra skin, lifts up the skin, and then it's attached at the top.
That's wonderful.
So there is a scar, but like you see in these clothes, they're hidden. Sometimes the scar will drift down onto the leg a little bit.
And let's talk about downtime as we go to picture number two, because what would
Sure.
downtime be on a thigh lift?
So downtime, the problem with it is it's an area that moves a lot.
Right.
So if we're up and walking and moving, it's a little more discomfort. It can cause sometimes some disruption of the repair where a suture will spit or open up a little bit. So it's not that you can't walk, it's just got to be careful walking, careful getting up, getting down. You wouldn't want to go walk 50 miles, but
Right.
walking around the house, walking around the office, usually within a week or two, we're good.
Okay. And what's happening in the second picture?
So second picture, kind of the same, a little closer view. She's had some fullness as well as some extra skin. So sometimes I will combine this with some liposuction to decrease the hip or also thin out the inner part. And the same idea, we've removed the extra skin. That skin is brought up on the inner part of the thigh, and then that's where the incision lays.
And let's go to picture number three. What's happening here?
So with this thigh lift, she had also had a previous tummy tuck. So she was concerned with the height of the tummy tuck scar.
Right.
It was a little bit too high, and also with those rolls along the inner part of the thigh.
Oh, yeah.
So if the skin is tight, often we can just do liposuction and get rid of the fat that's there, and the skin will tighten itself up. But when the skin's already loose, if we try to do liposuction, we'll likely get more folding. So I've done that upper thigh lift. So we're lifting again with that scar along the upper part of the leg. And then for
That's
the tummy
wonderful.
tuck, I've removed skin and the scar from below and brought that scar down. So it's almost like doing a mini tummy tuck after a tummy tuck. And it also got rid of the little dog ears at the ends, the little folds of skin at the end.
And it's so great to get rid of that big scar in the before picture. Now, a lot of women come in because they have excess weight and maybe some loose skin, and so there's a lot of chafing with the thighs, and that is
Yes.
a huge problem for a lot of women that I know. That it's just,
It's not just a little
Oh.
chafing. So people will get infections,
Yes.
they'll get rashes, they'll get discoloration in between their legs just from
Exactly.
the moisture and the rubbing. So this
Yeah,
helps.
this is fantastic. Now, you can leave comments, of course, since we're doing it on this platform. You can leave comments down below for the doctor, and in our next segment, we can answer those questions. So please leave your comments, your questions, anything that you have for the doctor. I do have a comment here from Diane, and this works perfectly with the thigh lift. Diane wanted to know, can you get rid of that cellulite-y look, that lumpy look? I mean, women hate
Sure.
the cellulite look. They hate the lumpy look. It
Yeah.
gets worse when
if
you're
we
on
had
the
a good way
beach.
to fix that,
Oh.
I'd be the first one to do it.
Totally.
There's some newer injections coming out with some mixed results, but
Ugh.
the problem with cellulite is it's in the skin itself.
Terrible.
So when you redrape the skin and pull it, the cellulite kind of comes along for the ride.
Ugh.
It's like the quilting in the quilt. But when there's extra skin, when it's redundant, this works very well.
That is, well, that's good. But I mean, there's got to be a way we can get rid of that cellulite. Come
Well,
up
I
with
see
it.
a lot of creams, I just wish they worked.
Yeah, that's true. Remember, you can see all these before and after pictures and many other before and after pictures at your websites, drmealy.com, sanfranciscobreast.com. And if you want more information on any procedure, you can give the doctor's office a call at 925-943-6353. Again, thank you, Dr. Joseph Mealy out of Walnut Creek, for joining us on Body Beautiful.
Thanks for having me.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of Cron TV, its management, employees, or advisors.